In this video, I'm going to go over the Covered California website. This is the website for getting health insurance in California through the Obamacare system, which is a federal system, but each state is going to have its own kind of marketplace where you can get healthcare plans. So the website is coveredcalifornia.com. And if you live in another state, there's going to be a similar website in your state that's going to, I assume, I've never actually gone into any detail on any of them, but they're gonna basically follow the same kind of pattern where they're gonna take your personal information and your income and just various aspects of your kind of profile and your healthcare coverage needs, and then offer you different healthcare plans. And depending on your income, will also kind of show you how much subsidy or discount you get on the premium that you're gonna have to pay for the coverage. So let's just go through the steps here on Covered California, and it should give you a good sense of what the other state websites are gonna kind of be about too. So one thing to note here, it says it right here on the front page that the open enrollment is over, meaning for 2022, so getting healthcare coverage in 2022, but you can still apply through special enrollment. So what does that mean? So open enrollment is a time, and in California at least, it's from November 1st of the previous year. So okay, so let's give you some exact dates. So if I was looking to get healthcare coverage for 2023, or if I have an existing plan and I wanted to change it for 2023, I could basically, in November of 2022, November 1st, this website will start offering plans and coverage for 2023. So between November 1st, 2022 to January 15th, 2023, I can come to this website and basically select new coverage or start new coverage for 2023. So kind of at the tail end of the year, you can start shopping around for coverage for the upcoming year. So again, that starts on November 1st of this year, 2022, for coverage starting in 2023. So it's saying here that the open enrollment is over because today it's March and the open enrollment for 2022 already ended on January 15th. So I can still apply through special enrollment. So what does that mean? It means that if you have certain life events that have happened, for example, if you had healthcare coverage through a job and you lost that coverage because you either left the job or, the job ended or you were terminated, whatever it is, you can still enroll. If you moved to California and are looking for coverage now, if you just turned 26, so I think 26 is the cutoff for being covered under your parents' healthcare plan. So if you just turned 26 and you need to get your own coverage now, you can still enroll. Or let's say you got married or entered into a domestic partnership, you had coverage for yourself, but now you need to get kind of family coverage, then you can still apply. So there's certain exemptions to this open enrollment being the only time you can kind of add coverage or change plans. So if you had these life circumstances, you can still do it. I'm going to go to this shop and compare link because I think this is going to allow me to kind of enter my information and then show me all the different options that are available to me. So let me go ahead and do that. So we're going to try to get coverage for this year. I'll put a California zip code. And I'm just going to hypothetically put $50,000. And let's say there's two people in my household. So let's say it's for myself and my hypothetical spouse. And let's just add this in just to say my spouse is pregnant too and see what we get. Okay, so it's just telling me this is in an application. This is just to tell me if I'm qualified, and that's why they're only asking for basic information. Okay, fine. Okay, so it's telling me that for myself, I may be eligible for lower monthly premium or lower out-of-pocket costs. So I'm going to get some kind of subsidy, it looks like. And person two, maybe because they are pregnant and my income was not that high, that they basically will qualify for Medi-Cal, which is basically full coverage. The state will pay for the entire cost of insurance. So let's just do a couple things here. Let's just remove this. Okay, so I just removed the pregnant checkbox here. And so you see here it changed it. Now both of us are just eligible for a lower monthly premium. So we can still get access to the subsidy from the government because the income for a two-person household of 50,000 is probably considered low income, or it's low enough that we're going to get some subsidy. So let's preview the plans. Okay, so it's asking a couple of things about the use. So let's assume we're a medium user. Let's just use the defaults. Okay, so now it's giving me a bunch of different options here. And you can see a couple of things. One is the company. So the Kaiser Permanente is a insurer, and they also are a health service. So they have hospitals and provide you with the healthcare. Blue Shield of California is a insurance company. So you could, for example, get Blue Shield coverage and then go to, um, you know, they have a network of healthcare providers. So I live in Sacramento, so UC Davis Medical is a healthcare provider, which probably takes Blue Shield insurance. So Blue Shield is not actually providing me the care; they're just kind of paying for my costs. Anthem is another just insurance company, and so you can basically see that there's only three providers of healthcare insurance that I can get: Blue Shield, Kaiser, or Anthem. And then you can see that there's different types of insurance plans. So Bronze 60 HMO. HMO stands for Health Management Organization. So Kaiser is a health management organization. And like I described, they basically pay for your healthcare and provide the care. So you have to go to a Kaiser facility. And Blue Shield, on the other hand, is a bronze PPO. PPO stands for Preferred Provider Organization, so it's just kind of an insurance term. But basically, it's much more flexible. You can go to a wider variety of doctors and healthcare providers, and it provides more flexibility, but it's oftentimes more expensive. But people that have kind of more serious use of healthcare and want to be able to control more options like who their doctor is and have more options for doctors, they may be okay with paying more because PPOs are typically more expensive than an HMO, which is more like a, I would say, for someone who just has basic healthcare needs and doesn't want to spend a lot. I would say an HMO is better. But this is again dependent on your preferences and kind of what you want. So you can see here the monthly premium is only $17 for this Kaiser plan. And, kind of as the names imply, bronze is the lowest, silver is a little better, and there's a gold plan here. And we'll look at what the exact differences are between those. But basically, I can get Kaiser healthcare insurance for two people for only $18 a month, which is pretty good because it's telling me here that I'm basically getting $773 per month as a subsidy. So you can see here that the federal government is paying $771, the state $2, and so they're paying Kaiser this 773, which is covered by the government, you can say, and then I'm only paying $18 out of my own pocket. So it looks like the total savings for each of these plans is the 773, but then the cost of the insurance is different because you're getting kind of different coverage. So this is kind of a very basic plan, but I only have to come out of pocket very little. This is probably a better plan for certain people, but you're gonna have to come out of pocket more. And you can see the silver plan um, is much more out of pocket, but you're gonna get more kind of coverage with this plan, and then the gold plan is even more expensive than the silver, but you're going to get even more. So now let's kind of look at what the differences are between these HMO and sorry, between the different colors. Actually, let's see what the next page is. Okay, so you can even see there's a platinum over here. So it kind of has a handy little feature to compare. So let's compare a couple of these plans. So let's compare the bronze Kaiser to the silver Kaiser to the gold Kaiser. So we can kind of have apples to apples. So we have these three plans. So let's compare. Okay, so this is your total expense estimate for kind of basic, just the cost of the plan plus some basic, checkup, basic lab testing. So it's giving you kind of a sense of, unless you have some big health event that happens, this is going to be your typical cost. And you can obviously see that the gold is going to be much more than the bronze. Okay, so this is not assuming that you're going to actually use the coverage in any serious way. So that's why, you know, you can't just look at this number in isolation. So you're obviously paying more for the gold, but what are you getting? Let's see, kind of what further down what the situation is. So a lot of these are the same. So these are all HMOs. These are all Kaiser is providing the coverage, and they are an HMO provider. Health savings account. So you cannot use the health savings account, which is something I talk about in a video I did on tax and kind of tax benefits. So refer to that video to understand what that is. But these are not HSA compatible plans. Okay, so you can't use them. And I actually looked, when just remembering back from the different options, there were no HSA eligible plans even offered to me. So maybe I'll go back and tweak the profile and try to get some of those to show up. But for now, just know none of these are HSA eligible. It looks like they have the same number of doctors because, again, you're going to be using Kaiser facilities. So they all have kind of the same network of doctors for each of these. But now this is where we start getting into the differences. So yearly deductible. So this is the amount if something happens that you'd have to come out of pocket for. So you can see that the gold has no deductible, meaning they're going to cover everything that happens. You're not going to have to come out of pocket if, let's say, you're riding your bike and you get hit by a car and you have to go to the ER and all that. The gold is going to cover everything, while the bronze, if something does happen, you're going to have to come out of pocket a lot more. So it's cheaper up front, but if something does happen, you're going to kind of be on the hook for more. And the silver is kind of in between. Drug deductible. So if you use pharmaceuticals, if you have like some kind of illness that requires that, the bronze package is not going to cover you fully. You're going to have to come out of pocket, while the gold does. Out of pocket maximum. So this is the same for all the plans. So this is kind of the most money between the deductibles and any copays or anything you have to do that you're gonna have to come out of pocket for. So you can see they're the same, but you can see that the gold is actually going to cover everything. So even though this might be because there's maybe some services that have copays, but it looks like the gold is going to cover most of everything you do without you having to come out of pocket. So this might not come into play for someone that has the gold package. Okay, so let's see. Okay, so yeah, this is why there is a copay for the gold. So you will have to come out of pocket for some stuff, but the big high value stuff that's going to cost a lot, it looks like the gold will cover. So in these, you start kind of seeing the differences also. So for example, emergency room facility, with the bronze package, you're going to have a co-insurance, meaning you're going to have to pay 40% of the co-insurance or the cost after the deductible. And of course, you're going to eventually hit a limit of your out-of-pocket max. But you can see for the gold, the copay is just $350. So if you go to the ER for the gold package, you just pay $350. There's no co-insurance, and so you're gonna have a very small bill. Even if you rack up a $20,000 ER bill, you're only have to pay $350. While if you same thing happened for the bronze package, you're gonna have to pay the full deductible, which was 8,200 plus 40% coinsurance. So you may, just from one ER visit on bronze, end up hitting your out-of-pocket max for the year. So you'd have to be on the hook for, this $16,000, or 8,200 for if it just happened to you, while the gold package person just paid $350. So, this is kind of, you're trading low cost upfront with the bronze for potential higher out of pocket if something happens and you kind of have to use the healthcare more than you expected. So, that's kind of the trade-off. If you have pre-existing kind of health issues, you may opt just to pay for the gold because you know you're going to be using the healthcare a lot. While someone like I would put myself in this category, I actually have bronze coverage. I take pretty good care of myself. I don't really need the doctor regularly, and so I just, I'm happy to just pay for stuff out of pocket if I actually need it, because it just happens so rarely. So it's not worth paying the extra, whatever, close to $300 per month extra for getting the gold package because my usage doesn't justify that. And of course, if something did happen, if I had the ER, I would just have to take the risk of having to pay out of pocket max. But you do the math. If you're paying extra $300 a month for the gold, you're already in it for an extra, 3,600 over the course of the year paying for the gold. So I'm just taking, and given the fact that getting hit by a car, while riding your bike or whatever is so rare, I'm willing to take the extra, $5,000 risk because I'd already be paying more for this. So might as well just, I'm willing to take the risk of having to come out of pocket potentially maybe $5,000 more by getting the bronze package. But again, this is for everyone's kind of unique situation. Again, if you use healthcare a lot, you may just want to pay the extra upfront to avoid the costs. So you can basically just keep going down the list here and see the differences, but I think you get the general idea. Okay, so I tweaked a little bit of the information I put in, and you can see here, I just basically raised the income. And so now you can see that some other plans are showing up, like this HSA plan. So again, you can view my video on what HSAs are, but this could be worthwhile if you're kind of it looks like higher income. You can also see that you are now only getting $2 of subsidy, because again, I raised the income, so I'm not getting any of the federal money. And for the same bronze 60 HMO plan, which was $18 when I was earning $50,000, is now 789,000 because again the federal subsidy has gone away. So this is kind of the point of this Obamacare system, where if you're lower income, the government is going to kind of pay for a lot of your insurance costs, while if you're higher income, you just end up paying most of it yourself. And again, just to emphasize, if you wanted to do the HSA route, you have to choose one of these HSA eligible plans. And again, you can watch the video I did on tax and HSA to kind of get a sense of if that HSA is right for you. So I just added a plan and then a dental plan, and I just wanted to show what happens when you apply. So I just added these to the cart, and if I apply, it's going to ask me to log in and do a bunch of things. But basically, they will just take more of my personal information and move forward with getting the coverage. So, it's just an application process online. It's not too complicated, and the insurance company will then take over and start communicating with you and send you information via email once the coverage is started. So one caveat to note is that we saw that when I raised the income, that I didn't receive any subsidy from the federal government for the insurance premium. There would actually be no benefit then to get the coverage through Covered California. You could just go directly to Kaiser or Blue Shield's website and get coverage through them directly. It may be cheaper, actually. I don't know, slightly cheaper to just do that. But basically, the Covered California is its main reason for existing is to calculate how much subsidy you would receive, and to kind of set that whole system up if you do indeed qualify for either partial or full coverage for your insurance premium through Medi-Cal, which covers you fully. And we saw that you would, in the hypothetical case I gave, if I had a spouse that was pregnant, that spouse would have been covered fully. So I would start my medical coverage journey and search through Covered California because it will tell you whether or not you qualify for the subsidy, which, as we saw, can be very substantial. Healthcare coverage is very complicated, and so this was just intended to kind of give you a first step and kind of an initial push on how to get started in your search and your research. So I would encourage you to both watch the video I did on healthcare insurance and also, for the items in the plans that you don't understand, to just read more online. There's plenty of information out there to learn the details of these plans and to also compare the different options. So hopefully this at least will get you started in that research journey.